pharmacy guys, you need to go down there. They have some of the neatest knickknacks and things in there, on top of having, really good people speaking and helping you out as well. But they have, I could spend hours in there. I've bought purses in there. I've bought shirts in there, scarves. It's just a great place to go. And it's right on Hawthorne Boulevard here in Torrance. And besides the great things around there, they have medical devices and it's just a different kind of pharmacy. So do stop by. I don't know what their hours are right now, but do stop by. It's a great place to look around and get your prescriptions filled at the same time. And you hope they take a long time, because you can look around and buy other things while you're there. So we're honored today to have Dr. Aamina Mirza. Sorry. She's a pharmacy doctor and a hormone specialist. She earned her PhD and her I'm just not here today. Her Pharm Doc and her MBA from Rutgers University. She is a certified hormone specialist and a pharmacist in charge at the Remedy Farm. Aamina has helped countless patients on their journey to health and wellness through in-depth consultations. She is the host of the Remedy Farm Health Minute, and you can find her episodes on YouTube. In addition, also the host of the Remedy Farm Health and interviews health radio show, where she interviews guests who discuss holistic approach to healing. Now that's really, really important, because we're looking at things healthier. And now she has with her today Susan McSharha. Did I do that right?
Yes.
Okay. And she has her master's degree in clinical nutrition. She's a certified restorative functional nutritionist and health coach, specializing in functional lab tests and metabolic rebalance. I need to come see you. So let's welcome our two gals today, our two our doctor and our nutritionist, to our lecture for today. So welcome, girls.
Thank you.
Okay, now, how are we going to do this? Because you have slides. Jocelyn? Where's Jocelyn? Okay, I think okay, you're not muted.
Yeah. I don't have slides actually.
Oh, okay. Well,
I could.
Okay.
I have a set. I can actually send them over. I didn't
No.
realize. Okay, so I don't. Oh, that would have been really good. Sorry about that, guys. I can send some over later. So okay, thank you so much, everybody. And guess what? Susan over here just went through a hormone certification class as well. So she's going to be certified in hormones very soon as well, which is really great, because hormones play a really big role in all kinds of things. Our metabolic status, our mood, menopause, in addition to
bone health, which is so important in seniors.
Bone health,
Yeah.
even pain, believe it or
Yes.
not, our hormones help modulate pain as well. So we're going to talk about a lot of different things today. We're going to focus on a few alternatives to pain management that I think would really resonate with everybody out here today. Can you understand me with the mask on? Are we good? All right.
Yeah,
awesome.
we're good.
Okay, great. So before we get into the nitty gritty, a couple things I'm going to throw out there. You may have heard of acupuncture. You may have heard of doctors of chiropractic or chiropractic practices, chiropractors. They help with pain as well. Of course, physical therapy, rehab, exercise, yoga, Pilates, Tai Chi, all of these things really help patients with pain, in addition to maybe some pain medications, and they help modulate the pain, intensity for patients across the board. Things like essential oils. Have you ever heard of essential oils? Great. They're gaining a lot more popularity. Yeah. So there's different essential oils that target different, what can I say, receptors or, frequencies in your body that help with a lot of different things. So on top of the cuffs, essential oils are really helpful as well. And even homeopathics. If you've ever heard of homeopathic medication, Has anyone here tried homeopathic medication before? Awesome. Jet, right? Great. Some people swear by it. Some people have never tried it in their lives. So homeopathics are really gaining a lot of momentum nowadays. I've done a few shows on the health radio show, which is a free internet radio, kind of like a podcast. And I've spoken with the health professionals at a company called Boron, which is really big in the homeopathic space. And they've talked about so many different issues that homeopathic medications have helped with. I'll go into that briefly. And then Susan and I are going to talk about something called low-dose naltrexone, which is a prescription-only compounded medicine that helps a lot of patients across the board. It's been studied for years. And at first it had only a few different applications, and now it's over. They're saying that it's helpful for over 150 different conditions. And believe it or not, I'm sure one of us will fall into one of these categories at least. So low-dose naltrexone is something really great, alternative to like those typical opioid pain medications that we really, really want to stay away from. Another really hugely popular by demand and request, also CBD. If you've ever heard of CBD, we will be going over CBD today. Topical CBD, oral CBD, what the difference is between that and the medical marijuana, and all of that as well. And then we did pick out a few items here to show you so you can put a product to what we're talking about as well. Another thing I wanted to get into was medical foods. That's something that people don't really talk about. It used to be prescription only. Now it's available in pharmacies and maybe some doctors' offices. So we'll keep it behind the counter, but pharmacies, some pharmacies do carry it. Of course, the Remedy Farm does, because you know how we like to be nice and integrative across the board. So something like medical foods, and I'll talk about one specifically called Theramine. It helps with pain management as well. Susan's going to go into the CBD for us today. She's going to go into a lot of different topical and different, I guess, some homeopathics.
Yeah, I'll go over some homeopathic, some herbal medicine or remedies, and it's not really medicine. That's very helpful for inflammation and pain. So we'll be talking about that as well.
Yeah, so she'll handle the nutritional side, I'll handle the prescription side, and we're gonna have a great talk. I'm really excited about it today, you guys. All right, are we ready? Thumbs up, yes, yes. All right, here we go. So let's start with CBD, because that's the most popular. Go ahead.
All right. Yeah, so CBD is gaining a lot of popularity. It's CBD is a cannabinoid. It comes from the hemp plant. The hemp plant and marijuana look very similar, but they're very different. So CBD is one compound and THC is another compound. The marijuana plant is high in THC. That's what those are compounds that give you that high that people get. CBD does not do that at all. CBD is great for kind of helping the body with a lot of different things. It helps balance the body, but pain and sleep are two of the things people come in to get CBD for, probably more than anything else. So there are topical rubs that you can put on that are good for like localized spots. So if you've got muscle pain or back pain or something, you can use those topical rubs. And then there are something called tinctures, which is an oil, or it comes in gummies. There are different delivery methods, candies. That is for internal. So a lot of people do both. If you take it internally, we have receptors in our body that helps that CBD balance. So the topicals are pretty much just for localized places. I have a couple of products. This one in particular is one of my favorites for muscle pain. I get a lot of cramping in my muscles, and if you're bending over a computer or whatever, this one is one of my very favorites. But there are others that, like these two, are more like if you can you see it? If you have heard of the BioFreeze, it's kind of a hot cold for muscle pain. This is similar to that with CBD in it. So these are just a few of the products. There are a lot.
Yeah.
There are some are better for like nerve pain. Some are better for muscle pain. A lot of companies add things. They have their product, the CBD, and then they add other things to it. like herbs or essential oils to kind of help that CBD work better. So there's a lot of different choices. And
I'm sure
you
it
know,
gets confusing, but that's why you go to someone's
Yeah,
place
so-
like here.
yeah,
So we can kind of guide you on
right.
which one might be most appropriate for you and maybe the type of pain you're feeling.
Yeah.
And that kind of
So
stuff.
if you tell us what you're experiencing, we can kind of guide you to a product we think would, you know, the CBD product that would work best. But it's been amazing for people.
Yeah.
It's, you know, people just can't live without it almost. And it's not habit forming. It's not harmful at all. It, you know, it won't go against any of the medications. So it's perfectly safe to take as well.
Susan, can you tell us a little bit about maybe some different applications for it, or like disease states or people that come in with X, Y, and Z that they really help with?
Just kind of pain in general. It doesn't really from the nutrition line and in the natural kind of product, we can't really make claims that this is good for a particular disease. That's what medicine is, and so it helps with symptoms more than anything. I mean, it's kind of a gray area.
Okay,
it helps
so it's a gray
balance the
area,
body,
but I'll
yeah,
tell you a
yeah.
little secret, okay? I have a lot of patients that have chronic back pain, that have fibromyalgia, that have a lot of inflammation and inflammatory, you know, type pain, and they use it and it helps them.
It does.
I'm not saying that it gets them off their other medication if they're on other medication completely, but there's many patients that are able to reduce dosages and start to, you know, start to feel a lot better in a safer way. Does that make sense?
So it helps more with the symptoms like pain, inflammation, people who can't sleep, but it's not going to cure a disease, I guess is what I was trying to get at.
Yeah. And I know somebody personally who has a lot of trouble sleeping. I know it's a little off topic, but the only thing that ever worked for him was the CBD gummy that had CBD and a little melatonin in it. Oh my goodness, that put him to sleep the first night. I was really surprised actually. So if you're having trouble sleeping too, you know, due to pain maybe, that's an option as well. So we have a lot of different options. So what Susan mentioned, a lot of topicals. So topical, basically, if you can point out where the pain is, we'd probably push you towards one of the topical creams or gels. They'd be really helpful. If you have something that you want to take more internally, like Susan mentioned, the tinctures, those are also pretty strong. So you would start really low and go slow and see where you react best. So everybody has a different, what can we say, like a tolerance for it, so to say. So you would start low, maybe start at what we use 1.5 mils.
We always tell people to start with there's different dosages, and so I would start with the lowest dosage, which is about 7 milligrams, and take like a quarter of a dropper full, and then, you know, as if that's not doing what you need it to do, just work up from there. At the worst, people feel kind of groggy, you know, so sleepy, groggy. So again, you don't have to worry about, you know, getting that high that a lot of people are worried about, thinking that it's marijuana. It's so that's, if you have too much, you'll just feel a little groggy.
And then, you know, to cut back a little bit.
Yeah.
And just keep in mind with the CBD, you can use the topical and the oral together if you need to.
Yeah.
We have a lot of patients that use a little bit of both as well.
It really works best that way.
Yeah, it's really good. Do you have any questions on CBD? Oh, we're going to go to questions at the end, right? Okay. So we'll continue. If there's any specific questions regarding CBD, definitely make sure you write it down and don't forget to ask us. We'll definitely get into it more. I wanted to talk a little bit about something that I love to talk about called low dose naltrexone. People may have heard of the word naltrexone. It is actually naltrexone in its typical form of 50 milligram tablets is used for opioid toxicity. So if someone takes too much opioids, that's when you have this relief medicine kick in and reverse the toxicity. Now, what doctors have found over the course of years, I think in 1984, they actually originally found that low dose naltrexone, meaning very, very low doses, I'm talking like 1 milligram, 0.5 milligrams of a dose, had an amazing effect on so many different things. Autoimmune disorders, it had an effect on pain disorders. It's had an effect even on, believe it or not, like fibromyalgia, Crohn's disease, multiple sclerosis, and different even like pain syndromes and even neurological syndromes. So neurological, I'm thinking major, even like different depressive disorders, surprisingly, like anxiety, major depressive disorders, even restless leg syndrome. Has anyone heard of restless leg syndrome? And you can't sleep at night, your legs are shaking like crazy. So this medicine has such a unique property where when it was first being studied, they only had maybe a few applications for it. And over the course of years, researchers and doctors and clinical trials have found that it's had over 150 different uses and across the board in different disease states. It's really, really amazing stuff. So how does low dose naltrexone work? First of all, it's prescription only. So if you want to get it prescribed, definitely talk to your doctor. If your doctor's never heard of it or they need some kind of guidance, I'll call them, I'll talk to them myself, no problem, okay? You just let me know. So how does it work? Basically what it does, it has what's called an antagonist effect on both the opioid and non-opioid receptors in the body. What does that mean? That means basically it blocks the opioid and the non-opioid receptors, and it elicits an effect which is basically saying anti-inflammation. So to kind of make it really easy to understand, it works in a way to delete or decrease inflammation in your body. Some of it's unknown, some of it's known. They do so much on this medicine. So it does, not only does it help with inflammation in your body, it helps with your immune system and modulating it or making it better or balancing it. It increases what's called endorphin production. And endorphin production has been linked to a lot of people who have like a delayed immune response or more pain and stuff like that. So when you take it, it kind of has a weird effect on your endorphins to make them a little bit higher, which actually in turn makes you feel better in a variety.
Endorphins are the hormones in our bodies that make us feel good.
Yeah, the feel good hormones. So that's how it kind of works. So I talked a little bit about reducing the symptom severity in fibromyalgia, Crohn's disease, multiple sclerosis, rheumatoid arthritis as well, and a lot of different autoimmune disorders. A lot of people talk about fibromyalgia, so this was something that I wanted to go into a little bit because I know there's a lot of patients that kind of suffer from that specific pain. So the fibromyalgia, what happens? You have like sensitivity to, pain and musculoskeletal, meaning that it's pain in the muscle. There's a lot of fatigue happening, or you're really tired, your cognitive disruption, and you have trouble sleeping as well. So what this does, and what happens is like, a lot of patients don't respond to traditional therapy like anti-inflammatories, or they take really strong pain medicines to just kind of numb it. And after a while, it doesn't really work. So, but they found that something called low dose naltrexone has really, really helped patients because there is some type of an inflammation going on in the background. So side effects of low dose naltrexone, some people do get a little bit of insomnia, although it does work best at night because it helps modulate those endorphins over that 3 to 4 hours in the middle of the night. And that is really what makes it work even better. Some people do get some vivid dreams. Have you ever heard of vivid dreams? So some medicines, they have that vivid dreams. So nightmares, or like very, very, what's another word for vivid? I don't know, like imaginative,
really
intense, dreams. So those are some of the major ones. Some people might have gotten some headaches, but for the most part, it's pretty well tolerated. So one great thing about low dose naltrexone is that there's no dependence factor to it. It's not expensive. It's actually a lot less expensive than many other medications. And it helps a lot with the chronic pain among other diseases, like I mentioned as well. There's really no drug interactions at the moment that have been found for it as well. And then you need a compounding pharmacy because it's not made commercially yet. So you reach out to your compounding pharmacy. We'd love to be your compounding pharmacy and we can make this specifically for you. What's great about it is that we can do it with like the least amount of fillers. So you won't be getting a lot of junk in that capsule. We make it without dyes. We make it, in a clear vegan veggie capsule as well. So you're getting a good quality product. Everything that we purchase here at the Remedy Farm is through high quality manufacturers of hormones and other, chemicals that we use in all of our compounding in the on-site lab. So that's the other great thing. Since our lab is here on-site, you don't have a long turnaround for prescriptions being made as well. So that's that's what I like to talk about for low dose naltrexone. Let me see if there's anything else I want to add. Back in a while ago, the doctor that kind of stumbled across it, he actually did a lot of research on AIDS epidemic too, when that all started. And it turned out that we talked about the endorphin, the happy hormones. The patients that had AIDS, they actually had 20% of the normal endorphin levels. So what he did, he's tried this low dose naltrexone on AIDS patients, and they saw a 300% increase in endorphin levels, and it helped them with their immune response. So there is correlation amongst different body functions as well. So it's pretty cool. They've been studying it in cancer as well. Low dose naltrexone is definitely something that I love to talk about. I love to read about because there's just so many new things that pop up every day. Let's see, anything else? Yeah, so I'm good. So I think that's what I wanted to mention about low dose naltrexone. Do you want to, why don't we go back to you now?
Okay. So along the lines of inflammation, a lot of pain is caused by inflammation. Almost all the pain in our body is a result of inflammation somewhere, you know, with whether it's the joints, whether it's headaches, whether it's in our stomach, it's an inflammatory response, which is our immune system trying to work for us, right? But when our immune system kind of goes overboard, we get this inflammation that causes a lot of pain. So along the lines of the prescription medications, there are a lot of herbal and homeopathy things that can be done to help lower that inflammation as well, that you wouldn't need a prescription for. Probably everybody's heard of turmeric, I would guess. It's a spice that is used in Indian cooking a lot. It's the yellow spice in curry. It has a lot of research behind it, and the more research is being done, the more things they're finding it's so incredibly helpful for brain health, heart health, bringing down that inflammation generally in the body. So there's turmeric is a root. You can get it in the grocery store and cook with it, but you can also get it in supplement form. Curcumin, you've probably heard of that, is a compound in turmeric. So a lot of people get those mixed or confused. So turmeric is the root. Curcumin is one of the compounds in turmeric. So one of the strongest is Turmeric Forte. It's by a company called MediHerb. This is one of my favorite herbal companies. They're very, very high quality. So if to take a turmeric alone, I love this product, but there are a lot of other herbs that help with inflammation. And it's kind of nice to have a combination product, so you're not taking a bunch of different pills. A lot of times they work together in what's called synergy. So taken alone, they're good, but combined, they're more helpful. So another product, this is a product called Caparest by Biotic Research. It has curcumin in it. It also has another herb called boswellia. I don't know if you've heard of that. You can get that on its own, boswellia, which is really helpful for inflammation. But this product has the curcumin, boswellia, ginger, which is also really great, resveratrol, which you've probably heard of. Yeah. It's from the seed of grapes, or the skin of grapes, red skin of grapes. And then alpha lipoic acid, which you may or may not have heard of. It's good for a lot of different things. It's antioxidant. So anyway, this product works from a lot of different levels. It's very natural. It's all herbal, and it's also just good anti-aging. It's full of antioxidants, so it helps our bodies age better. So that's one of my favorite combination products. Homeopathy is, we talked about that a little bit. That's another way to go. There are topicals, and there you can take them internally as well. Usually they're on like little tiny pellets, like a little, I don't know, you put them under your tongue and they taste a little sweet. If you're interested in homeopathy, I would really, really encourage you to go to the radio talk show. I'm going to interview a really great homeopathic physician that goes into it a lot. There are asking a question.
Is turmeric a blood thinner?
Yes, it can thin the blood. So, so the question was, is turmeric a blood thinner? So it does thin the blood somewhat. So if people who are on like Coumadin or the blood thinners, just you would use a very low dose. And it would depend on, how high of the dose. I would check with your doctor. I would definitely check with your doctor. Fish oil is also a really great anti-inflammatory, but in high doses, it can have some blood thinning properties as well. So yeah, that's another great thing about at the Remedy Farm. We've got both the pharmacists and the nutritionists, so we can kind of work together in helping you with, your natural products along with your medicines, because there can be some interactions and you do want to be careful with that.
Definitely.
Homeopathy, there is not though. So homeopathy is really, really great, really safe. It's been around forever. In fact, in Europe, it's kind of the go-to before prescription medicines are recommended. So this particular one is for arthritis, but if I can't pronounce these names, that's why I would go for this doctor. But a lot of homeopathy products have, again, a lot of combination in it. So if you look at the back of the box, which you probably can't read that, but if you look at the, good luck on pronouncing it. If you look at the back of the box, it says specific remedies for a specific pain. So some of them are for joint pain, for instance. Some of them are for, whatever. They're different ones. So the combination products are good because, again, they approach things from a lot of different ways. Arnica is something a lot of people have heard of. A lot of doctors actually recommend Arnica. It helps with bruising, swelling. It helps bring that inflammation down. So that's probably the most well-known, I would say.
And that's probably one of our biggest sellers in the homeopathic.
It's again in topicals. You can take it internally. So yeah, there are a lot of natural ways to go about things. So we can help you, any questions you have, you can come in, you can Zoom, you can call us, email us, and we can answer those.
So we mentioned briefly about hormone balance and how that relates to pain as well. That was one thing I wanted to kind of circle back to. Also, I wanted to let you know that, your diet also can lead to different things as well. So, and Susan is the master of this, but just briefly over the top stuff, if you are eating stuff that is pro-inflammation, you can be guaranteed that you're going to see some type of pain. Does that make sense?
Yeah. So just, and I'm glad you brought that up because we forget about how powerful food is. So food can be our most powerful medicine or our slowest form of poison. And you're doing one or the other with it. And there's a balance to everything. So, but if people who are eating, as Aamina said, what's called a pro-inflammatory diet, you're going to have a lot more inflammation in your body. And I've had a lot of luck with just using food to help people bring that inflammation down. If you have like bleeding gums, that's a sign of inflammation in your body. What's going on in your mouth, is kind of a mirror to what's going on in the rest of your body. But anti-inflammatory foods are our fruits and vegetables, which a lot of people don't get enough of. If we eat mostly a clean, whole food diet. So the processed foods, the additives, the preservatives, the chemicals they put into processed foods cause a lot of inflammation in our body. Fried foods, when fat was heated to a high temperature, as in frying, that causes a lot of inflammation in our body. We hear of fish oil a lot. Fish oil is an anti-inflammatory fat, and seed oils, like what you see in vegetable oils, that's a pro-inflammatory. So with our immune system, we want a balance of the two of those because we want to have a little inflammation. If you cut yourself, that's your body's way of fighting off germs, right? So you want some inflammation, but it's this chronic low-grade inflammation that most people have going on in their bodies is what's causing all that pain.
Definitely.
Also brings your immune system down. So you're
yeah.
less able to fight off, other things that you come across.
Yeah, definitely. Susan, I was going to ask you, you mentioned deep fried foods. Now, everybody has an air fryer nowadays.
Yes.
What is your thoughts on air frying food?
I think it's great. I haven't gotten one myself yet, but that's a really, really great way of having that crispiness that a lot of people love. I love that. That crispy texture without having to use that high temperature oils.
Okay, great.
So air fryers are
good
great.
substitute, all right, guys?
Yeah.
So you can still have your fried chicken. Just
Yeah.
don't drown it in oil.
Yeah.
Put it in the air fryer, and that'll help with pain as well. So,
Yes.
okay,
Exactly.
So, I mentioned hormones a little bit. I want to go back to that a little bit because we're both now. Susan's also a hormone specialist. If you're thinking, how many people here get headaches? Anybody?
Yeah.
Okay.
Yeah.
I got a couple
Some
hands up
you.
here. Yeah. Right here. Me too. So headaches are huge. People think that, oh yeah, I get a headache. I just take some Tylenol or I take this and it goes away. Do you think it's something normal? It feels like it's a normal part of everyday life, right? But it shouldn't be happening as often as they do.
It's common, but it's not normal.
Exactly. So it's common, but it's not normal. So sometimes hormone balance or imbalance can lead to something called headaches, migraines, all kinds of different things. So balancing your hormones can be an answer to some people for migraines and headaches. I just had a patient recently, just this week actually, and she was complaining about migraines, and we could tell that it was, with her cycle, and so it was pretty obvious that a hormone imbalance was happening with her. Something like progesterone was going to be very, very helpful for her. Even your cortisol affects it as well.
Absolutely.
So cortisol is your fight or flight response. That's when your body is like, should I, fight, or do I just bail? And when cortisol is kind of out of balance, that leads to migraines and headaches, among many other things. But we're talking about pain, so I'm just kind of throwing it out there. So we want to balance hormones. We want to balance our gut. We have so many things we want to balance here to help fight different types of pain, if that makes any sense. I hope it does.
So if I could interject just a little bit on that. So our adrenal glands, when we think of hormones, a lot of people think of, estrogen, progesterone, and testosterone, our sex hormones. But they're, insulin is a hormone. But the
thyroid.
Thyroid is a hormone. The adrenal glands secrete the cortisol that Aamina was talking about, and that's the hormone that is secreted when we have stress. And our body doesn't know the difference between physical stress, mental stress, emotional stress. Stress is stress, and the cortisol is going to be secreted. If you have a lot of cortisol all the time, you're going to be in something called a catabolic state. Your body's going to be breaking down. So another hormone from the adrenal glands is something called DHEA. People can supplement with that if it's low, but the DHEA is kind of what a lot of our sex hormones, a product that it comes from, or the compound that it comes from. So if you're secreting a lot of cortisol, your DHEA is going to suffer. And so DHEA is a building hormone. It helps us build and repair. So if you're always in this high stress state, you're not going to have enough of that building hormone. You're going to be in that breaking down state.
Yep. And don't forget, I mean, as we're getting older, our bones are more reliant on hormones as well.
Yeah.
So it helps with bone health.
Yes.
So
and strength
and all that kind of stuff. So looking at your hormones is really, really is a really good idea as well. We have a few questions on this side. Is nettles juice okay to drink?
Yeah. Nettles is an herb. It's anti-inflammatory. Yeah.
And then avocado oil and air fryer. I say yes. What do you say?
Okay, so I'm gonna show my ignorance a little bit on my cooking skills. I'm a nutritionist, but I'm not a big cook. So I haven't gotten an air fryer yet. My latest is the Instant Pot that I'm really loving. So my understanding was you don't use oil in an air fryer.
You don't need to, but sometimes you can spray it on. I've done it, and avocado oil is actually a better oil to use in general.
Yeah. Avocado oil or coconut oil
are
two oils that can be heated to higher temperatures without causing damage. Olive oil, actually, a lot of people, olive oil is a great oil too. So avocado, olive oil, coconut oil.
Yeah.
Those are great oils to cook with. But olive oil, you don't want to heat to a very high temperature. So
Yeah.
if you're going to be cooking and heating the oil, either avocado oil or coconut oil are the best.
Okay, so we have just a few more minutes. I wanted to talk a little bit about medical foods. I have a pamphlet here for medical foods and something specific called Theramine. And this is the one that really helps with pain management. So medical foods are basically, I'm just going to read it directly from here. So it's a formula used for the dietary management of disease, and it's made with ingredients that are safe by the FDA. And as I mentioned earlier in here, it used to be prescription only, and now it's not. So it did undergo clinical trials, and the FDA did approve this initially. So basically what they do is they allow certain amino acids to target and enter nerve, brain, and muscle cells. And once those amino acids are there, specific neurotransmitters can be made and released. Now, depending on which medical food you take, it kind of tells the brain which neurotransmitter to emit, essentially. So chronic pain, sleep disorders, depression, obesity, hypertension, asthma, all of these have its own specific medical food intended for it, okay? So, So basically, it supplies our body with the necessary ingredients to make certain neurotransmitters, and then those are released by the cells to help different diseases and conditions. Now, Theramine in particular is the one I wanted to go over today, because this is the one that helps to reduce pain and inflammation without any dangerous side effects. It's not an NSAID, so it's not something like ibuprofen. It's not an opioid, so it's not going to be like Norco. There's no reported GI bleed. So if you had sensitivity to something like ibuprofen or naproxen or anything along those lines, you should not have a reaction to this. And there's no cardiac events associated with it. Not addictive, not habit forming. So it's safe for patients with chronic pain. So people use it for chronic pain. They use it for lower back pain. They use it for fibromyalgia, neuropathic pain, and inflammation, like we talked about this whole time. So basically, the neurotransmitters that Theramine specifically kind of works on, those are the ones that help reduce the pain signals and inflammation throughout the nervous system. So, and that's how it kind of has its effect, and it improves the pain perception. That's the muscle, the joint, and the nerve perception. It reduces or brings down inflammation or swelling. And as we talked about this whole time, inflammation is kind of behind a lot of the pain that we all feel. And it manages maybe some metabolic processes, so processes within the body that are associated with something like osteoarthritis. And it also helps with those that are associated with fibromyalgia. And you could take it on an empty stomach, 2 capsules in the morning, 2 in the evening. And I think that's pretty good. And it's effective alone, and it works really well in combination as well.
So it's called a medical food because it's food.
Yes.
Okay. So it's an amino acid is a protein, and different proteins are needed to build different things. So that's why it doesn't have any of the side effects. It's not a medicine, it's an actual food.
And this is why I always have Susan with me. She always knows the nutrition side of it. And then one more thing I wanted to mention, since I was talking about osteoarthritis, if you know anybody who has it, there are something called biohacks out there. In one specific one, I just had an interview with a gentleman who runs Osteo Strong in Torrance. And it is very, very well documented on his end with doctors who send their patients who have osteoarthritis, who have, what's the other one?
Rheumatoid arthritis?
No, osteo, oh my gosh, I'm blanking right now. Women who have as you get older, our bones.
Osteopenia, osteoporosis.
Yeah, osteoporosis. What did I say? Oh, yeah, osteoporosis. I'm so sorry, guys. Osteoarthritis, osteoporosis.
Helps with brain too.
I know, seriously. There are brain biohacks. I think I need one of those. But so it's called the biohack, and it's Osteo Strong in Torrance. And what they do is they do something called osteogenic loading. It's basically weightlifting for your bones to make them stronger. So a lot of people say that, their pain has got improved, their osteoporosis has improved even more than, surprisingly, something like the Fosamax and all those other prescription medications that patients take, even those injections. So he's had some doctors really swear by it for him as well and send their patients for that as well. So that's something, and you can't be too old or too young to kind of start. But if you are pregnant, do not go there. That's what he told me. So yeah, so that was another thing I thought of to throw out there actually.
Yeah.
Oh, here we go. We have another question. Please talk about CBD scams on the internet. We will get to that. And what will help specifically with COPD? Well, that's a good question.
Well, I'm going to give that to you.
So COPD, chronic obstructive pulmonary disease. Let me think if there's one for, I don't know if I have a medical food for that. Let me get back to you on that one. I'll research a little bit on the COPD aspect of it for sure. Because other than traditional medications, I haven't come across too many things, but I can definitely look into it and let you know. And I'll even check if low-dose naltrexone might even have a place there, because it's surprising how many different things it does have a place for. I'll send it out to Jackie. All right, Jackie? So we'll definitely get that question answered for you. And I think that's our time. So we have 15 minutes for Q&A. Does that sound good? Okay. So
and Jocelyn will monitor people who raise their hand and want to ask a question.
Any questions?
Jetty?
Yeah. I just think that you should know that there's a lot of scams going on online if you want to buy CBD. So if you get to a website where you're trying to buy it and they want to have you pay just for the postage, don't say yes.
Yeah, no.
Don't say yes.
There are a
Because
lot of
they get
scams
your
on the internet.
information and they put you on a subscription without you knowing it. So I am fighting one right now. You know, I learned the hard way.
Oh no, I'm so
Aw.
sorry.
There are a lot of scams on the internet for all kinds of different things.
Yeah.
But yeah.
But that's one of the bigger ones. And also, you know, a lot of them on the internet does not really have any CBD in it.
Nope,
Right.
exactly. And that's the scam too.
Yeah.
It's
So
terrible.
that's the thing with nutritional products is they don't have to be third party tested. So your vitamins, your CBD, anything that doesn't require a prescription does not have to be third party tested. There's a big difference in different products. We carry what's called the professional lines of products. They're only sold through healthcare professionals. They're very high quality. They're tested. There was somebody did a test. They took like a vitamin C from a Costco and from a CVS and from, you know, all these different places and tested them. And some had no vitamin C in it at all. Or herbal products, no herbal products, you know, none of that herbal product. You can make all kinds of claims. So you have to be careful with what product you get. I get so many people that say, oh, I've tried that, it doesn't work. It's like, well, you probably didn't have either the right amount or the right quality. And it's huge. It makes a huge difference.
And you know, it's having good quality is worth it. Definitely. Of course, with these professional lines, that we only carry the professional lines for a reason, so we can kind of stand behind the quality of it. We rarely get a patient that tells us that something didn't work.
Yeah.
I don't think I've ever had anyone complain to me about that.
And things work differently for different people. So that's another good reason to have some guidance, because there's a lot of, you know, you read a lot of things. Well, this is good for that, and this is good for that. And, you know, we have people that come in with shopping bags full of stuff that they bought and it's really, as a metabolic specialist, I look at the why behind things. You know, somebody comes up with a symptom. It's like, well, what's happening? Why is that being able to present? You know, why is that occurring? And so looking at kind of the underlying causes of that is important. So a symptom can have a lot of different underlying causes. And so just throwing, you know, even if it's a supplement at a symptom, a lot of people, you're not going to get the result you're looking for a lot of times.
Yeah.
Valeria had a question.
Sure.
And I see Dave's hand. Who is 466747? who that is. Valeria, you're gonna need to unmute.
Okay, there we are. Is that better?
Yeah.
You can hear me now? Okay.
Definitely.
I was wondering about the question about COPD. Is there anything that would help COPDers? I was wondering if you would come across anything that might help people with pulmonary fibrosis. I know that's a stretch, but I thought I'd throw it out there. And the second part of my question is, are you familiar with sea moss and ashwagandha? I think it's pronounced.
Oh, yeah.
Absolutely. Yeah, ashwagandha is an herb. It's used, it's something called an adaptogen. So an adaptogenic herb does that. It adapts a gland. It doesn't stimulate or it doesn't suppress. So it doesn't, it just brings that back into balance. So in the example of the adrenal glands, you know, if you stimulate the adrenal glands, it's going to cause more cortisol. You know, so an adaptogen just brings that back into balance, and that's what ashwagandha does. It's wonderful. I love it.
Dave
Okay.
had a question.
Wait. What about sea moss?
I am not as familiar with sea moss. I would have to look that up.
Okay. And was there any anything for pulmonary fibrosis patients, like you would suggested for maybe COPD patients?
Yes, I will email Jackie with information on that as well. I want to get some really
Okay,
good
real
information.
good. Thank
for
you.
sure.
Yeah.
Yep.
Dave, if you want to
And I
unmute.
think CMOS is for inflammation as well.
Yeah.
So we'll get you some more information on
Yeah.
that as well.
And who's under the name Galaxy J3? Who is that? Dave, can you unmute? Joseph, go ahead and ask your question while we try and get Dave to unmute. Joseph? Did you have,
Joseph's not talking either.
Joseph, did you have a question?
Oh, yeah, so thank you. I think I'm unmuted. Yeah, can you hear me?
Yeah.
Yes.
Okay. All right, so my question is, I have a issue at my L3 and 4 lower back, and it's a mild bulge. So
Okay.
the pain level runs between like a 3 and a 4 off and on. And so I've been taking turmeric for years. And I don't know if that's helped, but I have that, it's an ongoing thing. So I was wondering what would be the best, because my concern is that inflammation all the time, to lower that inflammation. So what would you suggest?
From a natural point, I would suggest this Kappa Rest, because it's got the turmeric, the curcumin in it, as well as some of the other products that I was talking about, the boswellia, that will help bring that inflammation down. So I would.
Can you hold it up again? Can you hold it up so I can see it? So Kappa Rest.
Yeah, it's called Kappa Rest. It's by a company called Biohacks Research,
Okay.
which is a professional line. But it's a combination of the boswellia, the curcumin, ginger, resveratrol. So it's good for inflammation, but it's also got a lot of antioxidants and just a good supplement in general.
Okay.
But yeah, I would try that. And then I might, the CBD topical would probably be helpful for you. And have you tried acupuncture? That helps a lot of people. And then from a pharmacy's standpoint, what would you say?
Low dose naltrexone.
Yeah.
I love my low dose naltrexone.
So it's something I don't have a problem living with it, but I'm concerned is just the inflammation part, to reduce the inflammation.
Yeah. So there's, if I might put in a little plug, we have a physical therapist here.
Oh yeah.
That runs classes called Feldenkrais. I'm taking them. I have back problems. My structural, I got scoliosis, and but there's a I can't even call it an exercise class. It's very subtle movements. It's really great for seniors that have mobility problems.
Yes.
She's offering them via Zoom now, so you can either come in and take them or take them via Zoom. But that has helped me so much.
Yes,
I would
I
recommend that
do.
highly.
Yes, I do core every day for my back, and we have a friend who's a chiropractor, and he also has gotten his education homeopathic means, which has been awesome. So I've got a whole page of different things to strengthen that back area, which I've been diligent with, and it's amazing. I mean, it's really amazing. But again, it's just I'm just the long-term inflammation thing. That's why I want
Right, yeah, and that's good because, that's really good to address that.
Definitely. And just to throw it out there, patients, so some of the studies that have been done on low dose naltrexone, and I'm sure across the board, and a lot of anti-inflammatory type therapies. I mean, it doesn't give you 100% relief, but a lot of patients, if they see anything upwards of 30% difference, that's a success for them, right?
Yeah.
So, and that's what across the board, it was like at least 20 to like at least 30%, mostly between 30 and 50%, huge difference for them. And that helps people with their daily lives, quality of life, that kind of stuff. So
good. Okay.
Yeah.
Okay. I'll try that.
I'm very happy to hear that you're very diligent with your exercises.
Yeah.
Because the first thing I thought of was like, if someone gave me a sheet of paper to do stuff, I'd be like, okay,
Yeah.
I'll do it later. And I wouldn't do it. I need someone to keep me accountable. Because
Yes.
that's what I was gonna say, that if you do the Zoom, then you're accountable.
Yeah.
You know, every week I gotta be
Yeah.
there. You gotta show off to everyone. I mean,
Yeah.
I'm very competitive. I gotta show off to everybody that I can do it too.
And these classes.
Thank you.
You're very welcome.
Feldenkrais is a technique that Dr. Feldenkrais came up with, and it's kind of when we have injuries or something, we compensate, and then that becomes our new normal, and then you're walking a little off, or your structure's a little off, and the more you walk that way, the more things throw something else off. And what Feldenkrais does is it kind of brings that structure back to balance. And kind of reminds your brain how you're supposed to be, what your structure is supposed to be like.
Yes.
Thank you for your
Thank you.
questions. It was wonderful.
Go ahead,
Me?
Dave.
Hi.
Hi there.
Am I on?
Yep.
Yes.
All right. Recently, I have back pain too. And my doctor prescribed an anti-inflammatory. Now, I take a blood thinner, Eliquis. And the anti-inflammatory he prescribed was Celebrex. And he said that was safe to use with a blood thinner. I broke out in a horrible rash. My face was swollen, my eyes were swollen shut.
Oh my goodness.
I was a mess. I'm still suffering from it. I still have rash all over. I don't want to show it to you, but anyway. So you were talking about turmeric and Cabaret, but they're also like an anti-inflammatory. But what about Arnica and Theramine? Are they also an anti-inflammatory?
Arnica is, yes.
Yes.
And there's
What about Theramine?
Yes. Essentially,
I
yes.
should-
It
So-
tells your neurotransmitters to
But
kind
really,
of.
with a blood thinner, you can't take these things.
So the Theramine, you can actually, surprisingly, because it works like it works kind of like an anti-inflammatory because it helps modulate the pain, but it is not. Let me correct myself. It is not an anti-inflammatory in the sense of the word anti-inflammatory. It helps with inflammation, but it is not. It's not in the same class as ibuprofen, naproxen, Celebrex, all of that. It's not in the same class of Mobic, meloxicam, any of those. But it works to do the same thing with inflammatory modulators.
And the homeopathic, the Arnica is the same. It's not going to interfere with any medicine.
Because
Which is
it's
why-
the inflammation that really causes my pain. And
Yeah,
it's
and
just-
that's
it's
a lot of
cycle,
patients on the same thing.
It's
Yeah,
a
so the
cycle
Arnica-
and
Yeah. So either of those two choices would be good for you, the Arnica or the
Theramine.
Uh-huh.
Theramine, okay.
I think that's Barbara, 466-747, Barbara?
Yeah.
Yes. So instead of taking prednisone, what would you suggest?
What are you using the prednisone for?
Inflammatory. It's to help
Sorry
you
to throw
breathe.
you on the spot. Is it?
I
have you
don't
been-
know exactly what it does. I think Jackie probably would know. It just kind of helps you breathe better.
Okay, so yeah, so prednisone, a steroid is helpful in many different ways for different people. So depending on what you're using it for, I can kind of guide you a little bit better. So steroids help with pain and inflammation in the acute sense or like short-term sense. So a lot of patients, if they have a really bad inflammation that's causing, like a bulging disc sometimes, there's some patients that get them, injections in their knees and stuff like that, or they're on the oral medicine. They're on higher doses that kind of start to taper off or go lower and lower until they can come off of it. That's usually for like a high inflammation type pain use. And for that, there would be like one kind of, example or treatment or something you can switch off to. If you're using prednisone for something like rheumatoid arthritis, for something like COPD, for other for asthma, something like that, that's a little bit of a different application. So I wouldn't necessarily be able to kind of, tell you, hey, this is going to work for both. You know what I'm saying? So it depends on what you're using the steroid for, what the dose is at, what it is. So there's a little bit more I need to know.
Yeah, it would be more towards the COP.
More towards the COPD, yeah. So that's kind of hard to address because the steroids that are used, the doses and the types of steroids that are used for COPD are a little bit different than the doses and the types that are used for chronic pain, lower back pain, inflammatory pain, that kind of stuff. So that's a little bit, that's not something I can address today.
Okay.
With this.
Okay.
Yeah, but I can look into some options.
Okay, thank you.
Gretchen, go ahead.
Yes, I just want to warn you with if you do have an INR, you got to be really careful what you're taking here as far as supplements because they can really throw them off.
How many people are on blood thinners?
Excuse me?
Well, aspirin.
A lot. Yeah, that's
Yeah,
probably
you
true.
do have to be careful. And like I was saying, it's just because something is natural, there can be interactions. So it's very important to check that, or, that's again, why it's the pharmacy is great because, you can get that help from both ends and we can collaborate with each other. But yeah, anytime you're on really any medication, everything should be checked against that medication to make sure there aren't contraindications, even if it's a supplement.
Thank you, Gretchen, for that. Yeah, with the INR, because blood clots are a real issue, or it's something to worry about for sure.
I think we have time for just one more question. Jocelyn, is there anybody?
Well,
Go ahead.
how do we get in touch with your company?
Thank you for that question. You can call us directly, and we have email set up as well. You can email if that's easier. So the phone number to call, if you want to take it down, 310-375-0655. Press 1 for the pharmacy, press 2 for nutrition, press 3, I think, for Rosie. She's in medical devices. So if anybody needs medical equipment, she does. She's a certified orthotic fitter. So she fits people for compression garments all day long. She prefers if you ever need a compression garment, if you come in the morning before 11, because otherwise the swelling gets a little high and you won't get something that's accurately fitted. So compression garments, if you ever need something like that, canes, walkers, all kinds of things we got here. And the email address you can send any questions to is my email. You can send to me, manager, MANAGER, at the Remedy Farm, the THE Remedy, REMEDY, farm, PHARM.com. I'll put it in the chat as well.
Where are you located? What's your address?
The phone number.
Yeah. There's the phone number. Address is 23811 Hawthorne Boulevard in Torrance, California. So if you're familiar with this side of town, it's going to be right between Sky Park and PCH. And we're on the right side if you're driving towards PCH.
And the phone number again?
PCH. I typed that in there. It's 310-375-0655. You can email me directly with any questions and I will definitely get back to you. And then there's a second email. That's a more general one. Any pharmacist will respond to you at this email. And if you have a question for Susan,
Yeah.
I'm gonna throw her in here too.
Yeah, mine's nutrition at the Remedy Farm.
Nutrition at Remedy.
Yeah.
TheRemedyFarm.com.
Yeah.
Don't forget the the.
We want to thank you both for coming and for so much
you.
information, helpful information, and varied. Thank you very, very much.
You're welcome. And if you guys have any follow-up questions, please reach out to us. We are here to help for sure. If anything was confusing, if you forgot anything, if there was anything that, we didn't discuss that you think of later or you know about, let us know. And we'll be happy to do it again, or even on any other topics that you want to talk about, for sure.